Hey everybody, this is the Dr. Nurse with thedrnurse.com, and I'm just going to talk to you for just a real few minutes about DKA. What really causes it, what is going to kill your patient, and how is DKA like the keto diet? So I watched a few videos about DKA out there on YouTube, and I found just a few little inconsistencies about what exactly causes patients to go into DKA. Well, for the most part, it is not undiagnosed diabetes. These folks are type 1 diabetics. Most of the time, type 1 diabetics have been type 1 diabetics for a long, long time, and they are very well versed that they have the disease. They understand the signs and symptoms. They know when their sugar is dropping. They know when their sugar is going up. So most of the time, that is not what throws someone into DKA. Now, hyperosmolar hyperglycemic syndrome is a different story and a different video for another day. But what does cause it is when our type 1 diabetics get sick. The vast majority of patients that I have taken care of in my 12 years as a nurse that have come in DKA are patients who have contracted the stomach virus or contracted the flu or something that caused them to get sick. And that's what I've got laid out for the patho for you right there. So you have a type 1 diabetic, because our type 1 diabetics are the ones that get DKA. They have some sort of stressful event happen. Most of the time they get sick. Couple this with a prolonged insulin deficiency because they're type 1 diabetic. Their beta cells don't produce insulin like they should be. So what happens when stress enters our lives? Well, we produce catecholamines. Okay, remember epi and norepi? Well, what do those hormones do? They oppose insulin. So we have a type 1 diabetic who gets sick. Prolonged insulin deficiency coupled with release of those catecholamines, and we have extreme hyperglycemia. We have increased lipolysis because these folks don't have insulin to allow the glucose to flow into the cells, so we start breaking down the fat. Then we have the increased fatty acids floating around in the serum. Those get converted to keto acids in the liver, and before we know it, they've got full-blown DKA. What is going to kill your patient? Did you know that hypokalemia is the most important cause of death for our DKA patients? We actually want these people to come in hyperkalemic, because what are we going to do to them when they come in to get treated for DKA? We're going to start them on an insulin drip, right? And what does insulin do to potassium? It puts it back into the cells, okay? So we want these folks to come in hyperkalemic, which is usually not a problem, because y'all know that metabolic acidosis and hyperkalemia go hand in hand. If you're acidotic, you're going to be hyperkalemic, but we want them to be hyperkalemic, okay? Finally, how is DKA like the keto diet? I actually tried the keto diet for about a week. It didn't work for me. It works for a lot of people, but I just found it interesting that it is so much like DKA. Either way, your body can't use glucose for energy, right? With DKA, it's because of an insulin deficiency. With the keto diet, it's because of a glucose deficiency. You're not giving your body any glucose to break down. So the body has to break down the fat. That's how people go into a state of ketogenesis, and that's how they burn fat and lose weight. Interestingly enough, if you're on the keto diet long enough, you'll be excreting ketones in your urine just like a DKA patient. Anyway, thanks for watching today. Go ahead and visit me at thedrnurse.com. Follow me on Instagram, subscribe to the YouTube channel, and thanks for watching and have a great day.